And for the first time outside of a clinical trial, MDMA is being used in New South Wales to treat post-traumatic stress disorder. The first patients today revealing their experience with medicinal molly.
For the late-night club crowd, it's a four-letter word for euphoria.
Come check this.
But now MDMA is being used for a less sweaty service as a clinical treatment for trauma.
There's benefits at the rate of somewhere around 67%, where previous treatments had only been in the 20s in terms of effectiveness. So that's a big difference.
Approved for PTSD by the TGA in July last year, a Sydney clinic has become the first in the state to use medical-grade MDMA on clients outside of a clinical trial. A patient is given a controlled dose of MDMA in a clinic with a psychiatrist. The drug releases feel-good hormones like dopamine and serotonin that boost emotions like self-awareness and empathy, setting the scene for sufferers to discuss difficult emotions without being re-traumatised.
The usual medicine day runs over 3 months, and there are 3 medicine days. Each of those days are 2 therapists and running for 7 hours.
Patients like Shannon Foster, the mother of 4, has struggled with PTSD resulting from childhood and intergenerational family trauma.
Then subsequently she's got a 3rd layer of trauma, which is being in various unhealthy domestic violence relationships. All of these together are very hard to get over.
After a decade of seeing a psychotherapist, earlier this month, Shannon tried the new therapy. So, how did she go?
Let's ask her. Shannon Foster joins us now. Shannon, it's good to see you. Tell us, how was the experience?
Well, to begin with, it's a very physical experience. You get this sense, this feeling of just complete calm over your entire body, and you're not numb, you're not paralysed, but your body is just completely pain-free. You have no idea how heavy a human body is, and it's just euphoric. It's just beautiful. And then you sort of go on this experience. It's almost like watching a movie and having all of these different scenes sort of. It took me right back to when I was very, very young. I was only 4 months old, and I was very close to dying. And so it was a really intense and traumatic experience that I was aware of logically, but I'd never actually understood its impact in my life until I had this experience. So it's been really, really pivotal in my life.
A lot of people are very confused about how this actually works and find it quite difficult to disconnect it from this idea of a party drug. Can you just step us through the actual process?
Well, it's a completely different experience to the party drug. This is a medical experience, and it's an experience where it was very well managed. Like, I had to make sure I had a whole lot of different health checks. I was with therapists that I'd been working with for over 10 years. This place that I went through, Evolution, were just amazing, and they were really careful to make sure I felt safe and that I was protected, and that I was really supported through the process. It's completely different. So you are admitted to hospital for a day stay, and then you're administered the medicine, and then the next is just, an incredible experience of science and spirituality and energy and all of those things. It's incredible.
Shannon, you mentioned you've been working with some of these therapists for a decade, so you've obviously tried a lot of other things with them. How did this compare to the other kinds of therapy you'd tried?
I think, the main thing about this type of therapy is that it's almost like an express version. And when you have therapy, when you do psychotherapy, it can be an hour an appointment, and it's really, in a lot of ways, it's just not enough. You still have to go out and still live your life and continue on with your day. But something like this is very different. It's on a whole other sort of plane. It's an express version, it's an intense version, but it brings you to places and spaces with some closure and clarity that, 10 years of therapy can sometimes not quite get you there. So it's really when you're very stuck and there's just that block there that you just can't quite get yourself through, particularly with trauma, with post-traumatic stress disorder, with treatment-resistant depression. This is really quite powerful, really powerful.
Shannon, you've spoken about the euphoria, but what about the flip side of that? Was there a come down or any bad side effects?
There is definitely a come down. You in part of this program, it's really well scaffolded in that you have sessions quite close to the medicine day before and after, and all during the process. I've been really, really lucky to have amazing therapists and doctors that have made sure that things like the come down does actually help you and assist you in understanding and integrating the experiences you have on your medicine days.
It's great to hear that this has been such an effective treatment for you. Shannon Foster, thanks so much for your time.
Thank you so much. Thank you.